reason why, though, is the work that you did, along with a local doctor, who's going to come up here, Dr. Riopelle, and we collected all that Halloween candy. And Dr. Riopelle is going to do two things. He's going to present us with a check for all that candy we generated, and then he's going to talk to us a little bit about health and how we can keep ourselves and our bodies healthy as well. So here is Dr. Riopelle, and he's going to tell us what we did with our candy drive.
Thank you. Well, first of all, I want to congratulate all of you on a great job of donating your candy. How many people here, raise your hands, donated your candy to fun things? That's fantastic. Let's give ourselves a hand. Everybody give yourself a hand. That's great. So how many pounds of candy do you think we got? Who thinks 500 pounds? Who thinks 600 pounds? 700? 800? 900? 1,000? Yeah, so almost 1,000 pounds. 975 pounds of candy you all donated. And that's fantastic. So here's a check to the school for $1,000. We rounded it up. So it's $1,000. So your parents should really be proud of all of you. Now, why do you think we did this candy drive, this candy buyback? Who knows? Let's see, do you know? Yes, the candy is going to the soldiers. Exactly right. And I'd like to introduce Janet Burchard. She is from the Blue Star Moms, and she's going to take care of getting the candy to the soldiers. And maybe just, do you want to tell them just real quickly how you're going to do that?
We send care packages to the soldiers overseas in Iraq and Afghanistan, and we're sending a whole lot of them at Christmas time. And in those care packages, we are going to put some of your candy. Not just candy, we're also putting some healthy stuff, and we're also putting some socks and sometimes some fun stuff, like a frisbee or a hacky sack, but things that they can enjoy over there. And so we want to thank you very much for your donation and Dr. Riopelle for your thoughtfulness. It means a lot to the soldiers to get the care packages. They don't get candy over there. They don't have a lot of stuff that we have here. And so we send this so they know that we have not forgotten them. And I want to thank you very much.
So who else knows, now I'm a doctor, okay, so I take care of patients. Who else knows why I would want to do something like this? Why would I want to, do you know? Yeah, that's right, too. There's a reason I did it for all of you, too, besides just the school. Why do you think that is? Yeah. So we don't get cavities. Yeah, that's good. There might be one more reason, too. Yeah. So the soldiers will feel better, yes, because they'll get some special treats for the holidays, and that's really special. Okay, I'm going to just tell you, because we don't have a lot of time, the other reason that we want to do something like this is because we want you all to be really healthy. You are what you eat, okay? When you eat good food, it makes your body grow in a good way. When you eat bad food, just the opposite. So candy is not the best food for you. It doesn't mean you can never have candy, but it means that you should try not to eat very much of it. It's sort of a special treat, maybe say for a holiday or something like this. Who knows what this is? What's this? That's right. And this? An apple. Okay. So when we're talking about how we want people to look when we grow up, we use apples and pears. Why is that? Because we don't want people to look like an apple. That means really big and round in the belly. And that's what candy and sweets and sugar and Coca-Cola and things like that can do to you. They put fat right here in the belly. And then when you grow up, you end up with this great big round belly. Anybody who has a big round belly? Yeah? No, nobody at this age will, actually. So we want you to grow up looking more like a pear. A pear is small in the belly. Maybe a little bit more in the hips is okay, and that's healthy, but we don't want it in the belly. So the way to do that is you are what you eat. This guy over here, I don't know if you can all see this, but the guy on the right is kind of big. And he's got hot dogs and hamburgers and candy and all kinds of junk inside him. The guy on the left is small, and he's got carrots and strawberries and fruit and vegetables and things like that. So that's how we want you to eat. This is called a food pyramid, okay? A food pyramid tells you how much of each thing you should eat. And the things that you eat the most of are at the bottom of the pyramid, and the things you want to eat very little of are at the top of the pyramid. So at the bottom are the vegetables, and in the middle are milk and dairy products that are low in fat. A little higher are fruit, and at the very top are things like nuts and bread. But what's not on here at all? Anybody see? If you can see what's not on here at all? Yeah. Sugar, right. There's no candy on the food pyramid. Does that mean you can never have candy? No. It just means that you want to, this is how you should eat every day. Doesn't mean you can't have it as a treat. So it's okay to have it as a treat. That's why we're sending it off to the soldiers, so that they can have a treat. And it's okay for everybody to have a treat once in a while. But for the most part, you want to eat good diet without eating a lot of sugar in it, and without eating a lot of white bread and white type flour and things like that. Cookies and so on. Okay, has everybody got that? Yeah, okay. So I think that's about it. And again, thank you very much for all of your great work. You did a fantastic job. Thanks.